When we heard we were all going to be told to stay home, we realized that there were going to be a number of challenges. One is there are already people on the street, in the creek beds, and in shelters that may not be safe who are going to be really vulnerable. And how could we continue to serve them safely? And how could we bring some of them in out of the cold so that we could protect them from COVID?
Right away, we started seeing things like all of the basic essential services were closed. So things like food pantries, meal services at St. James Park, boom, gone.
We saw an increase in need for food and supplies for our neighbors out in the community that were already poverty-stricken.
I work with those who are homeless. They are vulnerable. They have a lot of medical problems. How about if you didn't have a place to shelter in place? You're out on the street, you're out at the homeless encampments. We knew that you needed to wash your hands. We knew that you needed to use hand sanitizers. And so we realized we are in trouble if we didn't do something real quick.
These schisms around race and class and other things that existed before COVID were only made that much worse. And so once we saw the scale of devastation, the need for us to employ and deploy new systems to reach those folks was really, really critical. And how could we get flexible resources to be able to make sure that happened?
Lots of folks in the nonprofit community who kind of never worked together before have had to work together to serve the community. And collaboration and coordination has become the name of the game.
We realized that we were going to have to think creatively and reach out to others and have lots of different partners to make sure that we could provide food and financial assistance to folks in our community, because the level of need was just astronomical.
The county as a whole, different agencies, public health, they all started getting together to figure out what to do. The mission was to make sure that we didn't lose so many of Santa Clara County residents.
We started actually broadening our network of nonprofit partners, and at one point worked with 70 organizations throughout Santa Clara County. So the funding that we raised kind of just went into that system, and that's probably been like the number one highlight. We found new partners, and we were able to kind of create a network where we could distribute the funding out through all of those partners and just quickly get it to the people who needed it.
We were all talking all the time throughout the growth of this COVID crisis, all trying to figure out what do we need, where do we need it, who needs it more, who needs it fast. We're out there to the networks and we're finding out where do you need X, Y, or Z, because we can deploy it to you right away.
Every day we're triaging patients, making sure that if they are getting sicker that we send them to the hospital, and we needed help, and we got help. The county, they were able to set up motels. So we started extracting some of the patients from the shelters, from the encampments, from the streets who are homeless and who are elderly and vulnerable, and putting them in motels. So it took a lot of agencies to come together to do that. That takes leadership. That takes a lot of planning. That takes a lot of support.
With the clients that we serve in our residential programs and in our homeless shelter and in the cafeteria, we were still serving meals. It made it so that we had a huge need for PPE. SVCN stepped up and actually organized an effort to help all nonprofits. They had this mini army coming together, and that was their focus, protecting the people that were at the front lines providing the direct service to clients, right? And I started feeling that togetherness.
Everyone jumped in, passing out food bags, going out to the encampments to distribute food and PPEs, distributing vaccines, testing. We were purchasing millions of dollars in gift cards and distributing those. And everyone's like slightly afraid of, contracting COVID and whatever that might mean. But we just, that sacrifice and the courage that people had to jump in, I think has been the hallmark. And that's been across the board. I mean, every nonprofit that I can think of in our network just said, what can I do? What are we most positioned to do?
A good network has at its foundation trust. So if I get a call and they say, Chris, I need X and I need it today, I don't have to think about it. All I have to do is react because I know them and I trust them. That's the power of a network.
During this time, I've seen some incredible sacrifices that have really honestly blown my mind. I've seen nonprofit leaders who spend, hours and hours a day trying to fundraise to keep their organization alive, give up funding to pass it off to another organization that they thought needed it more. That's incredible.
You know, sometimes when you're on your own, you do your own piece. But this required a network of programs to be able to work together. Yes, we deliver healthcare, we go out to the streets, we go out to encampments, but we didn't have housing. Office of Supportive Housing, they know how to get people into housing. People like Downtown Street Team, they know how to go to encampments. People like Destination Home, they know how to bring people out from the street into homes. So this team needed to work together in order to make it work. If it was just every agency do your own, it would be so haphazard that we wouldn't really be successful the way I believe that it has been.
We're maybe in the last stretches of the disaster piece and we're moving towards recovery. The recovery, though, it's going to be long. We're not going to be able to do it without collaboration, without coordination, in a deeply cross-system way, thinking about where we want to land and thinking about how we want to get there and who's going to do it. And relationships are going to be central to a lot of that work.
This was a moment of crisis, but a moment of people stepping up beyond their traditional barriers. So when I think about the future and what I'm looking forward to these networks is like networks that are based on shared values and a redefinition of what the common good looks like, so that we are present for each other and understand that we need to look at this through a prism of race equity, a prism of justice, a prism of where we want to grow and continue and believe that we can work on something together.
It's an energizing feeling. It's why I like working in nonprofit and why I will hope to never do anything else, because everyone's has that community spirit and everyone wants to help. We don't always have it all figured out. We fight with each other, but we have the same true north of wanting to do right for our community.
There are just dozens and dozens of people who are working 12, 14, 16-hour days, bringing people in from the cold, bringing food to elders, people who are, in their homes and vulnerable, folks who are completely creating new business lines so that they could respond to this disaster. And no one I called ever said no. It's incredible. It's an incredible testament to the human spirit, to our local relationships, and I'll never forget it, and I'll always be forever grateful.
I am so thankful. It's really something to see that programs, groups, businesses can come together at a time of need and help the residents. If there is nothing else that happens through this, is that people see one another, that we are actually the same. We are all on this planet together. It takes all of us to make sure that this is a place that we all call home.
I look back and the overwhelming feeling that comes over me is feeling blessed. It's like the whole community coming to recognize the value of a human life. That at the end of the day, when there is a crisis as big as this and as unprecedented as this, that we can come together and take care of what needs to be taken care of, right? And at the top of that list is other humans, right? And humans that need the help the most.